Summer is right around the corner, and before you head outside yourself or you take the kids to the pool or hit the park, we've got to talk about sun protection and skin cancer prevention because it is a major issue, even here in Western Washington when we have lots of cloud cover. In fact, I want to talk to you about some statistics. According to the CDC, in 2015, there were 35,000 plus new cases of skin cancer in our state. For every 100,000 people, 432 cancer cases were reported. And according to this map, the counties in Western Washington with the highest number of cases included Snohomish, Pierce, Mason, Jefferson, Clallam, and Grays Harbor County. You can see there the rates in King County were slightly lower. Dr. Barbara Fox is with Pacific Medical Center. Thank you for being here. What are the biggest mistakes that people make when it comes to sun protection?
Okay, one of the first ones that I would mention to people is you've got to remember to put sunscreen on all the areas that are not covered by clothing. And we often forget certain areas like the back of the neck or the V of the chest in women, or if you're wearing a baseball cap and your ears are showing, make sure you get it on the ears. That's probably one really important thing. The other thing is to use it every day. People don't think about, like you said, using it in the middle of the winter when it's rainy or cloudy. Do you really need to use sunscreen? And you really do. 80% of the sun's rays still come through clouds or rainy days.
So let's talk about sunblock. What should people be looking for when they head to the drugstore to buy sunblock? What is the best protection? So
the best protection is, I always tell my patients, find one you like and that you will use every day, and that's the best one. Find one that's user-friendly for you.
What kind of SPF do we need to be looking for? What kind of spectrum? What are the terms that we need to find on the outside of that bottle?
So pretty much the American Academy of Dermatology recommends that everyone use a minimum of an SPF, which stands for sun protection factor, of at least 30. Out here, 30 is probably good year-round out here because we live in a higher latitude than many other places. In the middle of winter, if you get to go to Hawaii or Mexico, you won't have much color to your skin. So if you go to a place like that, you won't have any self-protection at all. And so I definitely would increase the number to at least an SPF 50 if you're going to be someplace tropical in the middle of the winter.
All right, you brought up sprays. Are those a good thing for people to use? We've heard mixed reviews on them.
Everybody thinks the spray is going to be easier because they think it's going to have no contact. But in actuality, number one, you should never spray a spray sunscreen in your face. We're very concerned if you do this for years that if you're inhaling this, it may eventually cause some problems in the respiratory tract, and we don't have all those answers yet. So if you're going to use a spray, you need to spray it into your hands, rub your hands together, and then put it on your face. And then if you're spraying spray sunscreen like on your children or trying to get your back, really it's not an even application. It's hard to get an application that's really even, so you really should rub it in. So it's not really hands-free. It's going to work better if you rub it in.
What are the three most common types of skin cancer?
Skin cancers. The most common kind is called a basal cell carcinoma. And fortunately, it's the one that acts the least severe, and it's the one that's the most numerous.
Okay.
So that's the most common one that we see. The second most common is called a squamous cell carcinoma. Also usually not life-threatening in most cases if caught early. And then, of course, the one that everybody is more knowledgeable about is a melanoma. And melanomas can be very deadly, especially if they're not caught early.
Why do you think that skin cancer rates appear to be on the rise?
Well, they definitely are on the rise. There's many factors. A lot of people put the ozone layer, the loss of the ozone layer, and the chlorofluorocarbons, the CFCs, back in the 70s really did a lot of damage, and then they started regulating that, so we have a loss of the ozone layer. I think people are more aware, so they're coming in earlier, so we're catching more numbers because we're catching them earlier. Tanning beds have been a real issue. Tanning beds increase the risk of skin cancers pretty dramatically, and that's why there's been so much more regulation on who can go tanning anymore. People are not compliant. They don't use their sunscreen. And I think we're such a mobile community now. In the middle of winter here, people go to sunny climates. They go to Hawaii and Mexico, and they get more sun exposure than they would here at home.
Dr. Barbara Fox, always good to see you. Appreciate your time.
Thank you for having me.